Active surveillance is a crucial strategy in public health, involving proactive efforts to identify cases, monitor disease, and collect high-quality data. Especially when it comes to human health, active surveillance has many benefits. For example, the elderly can use a machine to measure their blood pressures at home to monitor their health status. If the data is abnormal, the elderly can go to hospital for treatment in time. This approach involves regular contact with healthcare providers to gather data on specific disease or conditions. While resource-intensive, active surveillance provides more complete and high-quality data, enabling early detection and response to health issues. Let's look at what medical experts say about active surveillance.
So active surveillance is a treatment option that involves close surveillance and monitoring the patient. And then if there's any progression, more intensive treatment can be considered at that time, but intensive treatment is usually not recommended initially. And active surveillance has been used for prostate cancer, although there is room for it to be implemented more broadly. Active surveillance is in clinical trials for thyroid cancer. And then active surveillance is in discussion and the start of clinical trials for breast cancer, but is not implemented broadly. And so this study is important because there are benefits to active surveillance. Specifically, active surveillance would not be associated with the surgical complications or radiation complications that can be seen when treating thyroid, breast, or prostate cancer. There is still going to be worry because the patient still has a cancer diagnosis, and they are going to need close surveillance by their physician. And in order for this to be implemented broadly, we first need to define which patients are candidates, what the active surveillance strategy would be, and if what's been done in trials could necessarily be done in the population at large. We need physician and patient buy-in, so this has to be accepted by the community in order for us to utilize it. And then we also need to address risk for patient harms, meaning making sure we reduce the likelihood of patients being lost to follow-up or having progression that's unrecognized or being misclassified. And then it's going to be very important that we address patient worry.
Then let's look at a story. This man is Charlie. Charlie shares his experience with active surveillance after being diagnosed with very low-risk prostate cancer.
An alternative for management of prostate cancer. It involves careful monitoring as opposed to immediate treatment. It's only one available option. Treatment is also an option for men who have more aggressive disease.
After that, Charlie chose for the active surveillance program at John, which involves regular monitoring through PSA tests, digital exam, and periodic biopsy to check any changes in the cancer status.
What we've learned is that less than 1% of these men will die of prostate cancer over 15 years who are in monitoring. So we consider this to be a very safe approach for selected individuals, which has now been exported beyond the walls of Hopkins and is considered standard of care throughout the world.
This approach allowed him to maintain his quality of life without immediate invasive treatments. Charlie also emphasized the importance of thorough research and consulting with healthcare professionals when considering active surveillance as a management strategy for prostate cancer. Active surveillance may have psychological effects, which means that it's not suitable for everyone. For instance, regular appointments may interfere with patients' life or annoy them, and repeat tests may make patients uncomfortable. In conclusion, active surveillance is a powerful tool in disease control and prevention. Despite its challenge, investing in active surveillance remains essential for emerging health threats. It is important to achieve a balance between effectiveness, resource availability, and ethical considerations. Thank you for watching this video.